Hello, everyone, and welcome out to Fairview Park Hospital. We're here in the rehab area. We're with Kelly Cook. You'll recognize her from being on many times before, and quite active in the community. You're no stranger to being involved everywhere, and that's one of the great things about Fairview Park and employees. You guys are always so involved with everything. Thank you for
You're
what
welcome.
you do.
I love it.
So, how long have you been here with rehab at Fairview Park?
I have been here for almost 24 years now. In October will be 24 years that I've been here doing the cardiac and pulmonary rehab program.
And so you stay real active. I know you help a lot of people, and so that leads to an active lifestyle for you, I guess, Kelly. You see so many people who are faced with issues. And so as a rehab director here, you have quite a staff. Let's talk about your staff first of all.
Okay, all right. So we do have a multidisciplinary team here. So we have our medical director is Dr. Barry Waters, and he oversees our program. And then we have an RN that works in here, Miss Gwen Upshaw. We have two registered respiratory therapists, Miss Amanda Spivey and Lindy Lovett. And then we also use some ancillary staff to help with our dietary needs and our pharmacy needs. So we have a dietitian, a pharmacist, and a social worker, all from the hospital, that come over and help our patients with the needs in those areas also.
Yeah. Quite a staff, a lot of people coming in and out of here. I see that, Kelly. About how many people you think you treat in a week, or do you help in a week here?
It's hard to say. We probably have about 40 patients a day coming through.
Wow.
So we do see quite a few patients per day.
And what type of issues, what brings people through rehab? I know it's a referral, it's from some type of cardio issue, so let's
Right.
talk about that.
So we do get referrals from our cardiologist, our local cardiologist, or they can come out from Macon, we get them from Atlanta, from Augusta, anywhere, for our local patients. And the patients that come through the program are patients who have had any kind of heart issue. So if they've had bypass surgery, if they've had heart attacks, stents placed, if they have congestive heart failure, if they're just having angina pain, which is like chest pain, things like that they're dealing with. We also cover if they have any what we call PAD, peripheral arterial disease in the legs, any kind of blockages in the legs, they can come through the program. So there is a large number of valve replacement patients can come through the program. So there's a large number of diagnoses that are qualified for them to come through.
Every patient's individual, I'm sure.
Correct. Everybody's got their own diagnosis. We also, as the patient comes into the program, we'll do an individual assessment with them to find out their needs, and we develop an individual exercise program. As each patient comes through, they will, not only with the exercise, but we also offer them any kind of education they need. If they have high blood pressure, cholesterol issues, or diabetes, we make sure they have all the education they need so that they can live as heart healthy as they can going forward from this event.
Yeah, of course, when we come out and we speak to you, you like to share with people preventative ways, things to do to stay away from the issues. What are major mistakes that we still see being made?
Well, diet is a big issue, and especially in the area we live in. Diet's definitely a huge, not eating properly. And then the lack of exercise. Our society has become very sedentary. We're very screen-oriented with computers, and so we've become very sedentary. So between the diet issues and not exercise, and that can lead to a lot of our heart issues that we see.
Yeah, and we've seen some just so basic of routines to make with people as standing up from your desk every 30 minutes and moving around a few minutes.
Correct.
That helps tremendously, and if you don't know, you don't know, but
That's
getting
right.
out the information is always good.
Yes.
High fatty diets, things like that people don't really realize, but I'm sure
Right.
you want to offer some of those suggestions, especially with it being Heart Month.
Right, that's right. So yes, and we offer a program here too. If a patient has not had a heart event yet, but they have some risk factors like high cholesterol, high blood pressure, they can come through a program we have here also to get them going in the right direction to help avoid a heart event. But definitely watching, like you were saying, watching the high-fat foods, watching your sweets, watching, eating more fruits and vegetables. That's the big push, is trying to fill your plate more with fruits and vegetables and then get your proteins in there too. But watching what you eat and getting moving. 30 minutes a day is all it really takes. And, 30 minutes, go out and take a 30-minute walk. It doesn't have to be an intense exercise program. It just needs, you just need to be moving. It's important.
And a lot of people they think, oh, I have to exercise, I have to go to the gym. That taking that walk is huge.
Right, that is huge. It helps not only with your heart and lungs and exercise, it helps reduce stress. It helps just overall improvement of your mood. So, and that's a big part of what we also work with our social worker is the emotional side of going through all this. There's a lot of anxiety, depression, stress that goes along with heart disease, and so we have our social worker come in and be able to work with the patients on that area also.
Okay, and we have great heart doctors throughout the area, and like you say, you help patients anywhere from Macon, all the 15, 20 counties
Right.
around Lawrence.
Yes, and we reach out to all those physicians. It doesn't have to be a cardiologist. We work with a lot of cardiologists. A lot of our primary care doctors will refer, but there is a new push from the CDC and CMS to increase the referral rates for cardiac rehab. The referral rates are pretty low, and we're trying to increase those. So we're working closely with the physicians to try to get some standing orders in place to where a patient has a heart event, they're automatically referred for the cardiac rehab. So that's a big, because it's an important next step for the patient after they've had a heart event to do a cardiac rehab and to get them back on the right track.
We're going to have people who have these problems just from genetics, from lifestyle and what have you. And so our point here, ladies and gentlemen, today is you must take that next step for rehab. You
Right.
come in and they evaluate you. They work well with your doctor. They educate you because, again, if we don't know, we don't know.
Right.
So you come in for the rehab, and then you set up a program and you monitor them all the way through. And what's the average length of a program, rehab?
Usually the program lasts for about 3 months. Most insurance companies allow 36 visits. And then we do have a maintenance program where the patient can stay for 2 more months and do our maintenance program. So they can be here from average 3 to 5 months. And so that really helps them get into a good habit. They learn what they need to learn. They get into the habit of exercise. And then our goal, we work with them on how they're going to continue their exercise. Are you going to join a facility? Are you going to exercise at home? How are you going to continue? Because this is a lifelong, one of our little sayings is rehab for life. You have to do this for life. It's a lifelong process for you to continue with this healthy choices and healthy changes.
Yeah, such a very good point, Kelly, that most people think, well, I'll go to rehab for a while and I do that and then I move on. I
Right.
don't continue. Well, it's to teach you a different way, the proper way of lifestyle is to teach you what you need to be doing to not only to recoup, to heal from your surgery or whatever procedure that you've had, but then to set that lifestyle in
Right.
place, isn't it?
It is very important. It is. And again, we do, they do, and we sometimes see some patients have to come back through. But a lot of it, there's stuff we can control. There's risk factors like high blood pressure and cholesterol and things that we can try to control with our diet and exercise and medicines. But there's risk factors like our age, our gender, our race, our family history, things that we don't have control over that sometimes may lead to another event, but you're educated now on it and you know how to move forward with that. So that's the important part.
Yeah, and you can control many of the factors, can you
Right.
not?
You can. Those are the top 3 things through your diet, your exercise, and proper medication use. You can control a lot of your high cholesterol, your high blood pressure, diabetes. But you have to be educated on it too. It's important.
Yeah, so Heart Month, and this is cardio rehab awareness. And so what do you say to the community? What's the basic about what you guys do here, and how do you educate them on that?
So I just would say, really taking care of yourself with eating right and exercising. If you do have a heart event, it's very important to talk to your doctor about it. Come see us out here at the hospital, and we can help you get the referral we need from the doctor. But it's very important and it's important to get in as soon as possible after your heart event, not to wait several months. You want to go ahead and get started with it immediately. A couple weeks after your heart event, you want to go ahead and get started with it.
Yeah, you have to change that lifestyle
Right.
if it happens to you. Now, if you have a history of this in your family, if the genetics are there, if you know of parents or siblings or what have you had the issue and you're approaching that part in your life, again, they can come and gain information from you. They can
Correct.
call and get some advice from the professionals here at Fairview
Right.
Park and how to possibly avoid or to do everything humanly possible.
Right. And
to
like I
avoid
said,
it.
we do offer that program also, that a patient who has not had a heart event yet, but wants to be monitored before joining like a fitness center or something that needs a little monitoring and education, they can come see us and we can work with them also. So we want to be on the front side of it much more than on the back side of it.
So the number's 274-3470.
Correct.
To be able to reach in, you help with so many different parts of patients and their heart. In cardiac rehab, I see with heart attacks. If they've had a heart attack in the past 12 months, they need to come.
That's right.
Chest pains. Let's just go through the list here.
Right, yes. So, like you said, with the heart attack, within the last 12 months, that's an insurance guideline that we follow. But again, if the patient has a heart attack, you want to try to get in within 2-3 weeks of having your heart attack. If they're having chest pain, we can work with those patients. If they've had a valve replacement or repair, if they've had bypass surgery, if they've had stents put in, there's a multitude of diagnoses that we can help with. Congestive heart failure is a big one that now Medicare is covering, and it's a very important that's really important to get the patient exercising, getting that heart muscle strong, and teaching the patient about what you need to look for with congestive heart failure to avoid having to be readmitted to the hospital again and things like that.
Yeah, there have been so many advancements just in the time that you've been in the profession,
Right.
haven't there?
Oh, yeah, there has been so many. And a lot of these diagnoses that are now covered, of course, we have to follow insurance guidelines a lot of times. And but when I started, a lot of these congestive heart failure, the peripheral arterial disease, were not covered by insurance. And now they have seen that the improvement in the need for the cardiac rehab following these events, that they cover them now. So that's an important thing. And we always verify that before the patient gets started to make sure everything's going to be covered for them and whatnot. So, but that's an important need.
Yeah, so professional, and you're so diligent in trying to educate people. And so during Rehab Awareness Week, Cardio Rehab Awareness Week, we encourage you, ladies and gentlemen, to call the number if you have questions. Live a healthier lifestyle. That's what Fairview Park is here to try and help you with.
Yes.
Again, your staff's here every day working hard.
Yep.
You help people from the very basic beginning of the program all the way through it. So there's no need to fear it.
That's right. And that's a big thing of it too, is that you are supervised. And, there is a lot of fear that goes along with after you have a heart event. What can I do? What can I do? Things like that. So that's another positive reason to come through the program, is to be able to figure out what you can do, what you can't do, while you're being monitored. So that's a good, yeah.
Well, thank you for what you're doing, and much more success, and much success to you, ladies and gentlemen, in your approach for a healthy heart. If you need more information, we've given you the numbers here on the screen, the website to get in touch with Fairview Park. Many times you guys will have different seminars to come along too. They can monitor you there on Facebook or on the website.
Correct. Yes.
So that you're able to get more information as doctors and professionals speak to our community. Thank you for what you're doing, and continued success.
Thank you.
We moved here for my husband's job and just quickly really fell in love with the community and the people in it. Well, when we found out we were having our third child, we were a little surprised, but we were also very, very excited. And immediately we had a lot of people ask us if we were planning to go back to Atlanta to deliver, or even to Macon to deliver. And really, with all of our great experiences at Fairview, it never crossed our mind to give birth any place other than here. So Wesley joined our family in September, and we were very thankful for a quick and relatively easy birth, and just really, really impressed with the care that we received from the doctors to especially the nurses and labor and delivery and in recovery. Everyone just treated us with a lot of respect, very professionally, but also with a really personal touch. A couple of people that stood out to me from my experience here: Teresa was my labor and delivery nurse, and she was with me from the moment we checked in throughout the entire day, and even after the baby was born. The next day she was on shift again, and she dropped by just to say hi and see how we were doing. Candy, the lactation consultant, was really, really great and answered a lot of questions that I had, and just was really, I think, genuinely concerned about helping me adjust, and not just around lactation, but just about being a third-time mom and and having a newborn again.
And now we welcome Tiffany Fordham. Tiffany, tell us what you do here.
I am a registered nurse in the cath lab, so whenever there's a patient in here, we just kind of circulate and help the doctors and also monitor the patient.
How long have you been involved in this type of work?
I have been in the cath lab since September of last year, and I graduated nursing school in May of 2018, and prior to coming here, I worked in an ICU.
Okay. Have a lot of experience then with this type of patient.
Yeah, sometimes the patients we bring into the cath lab are very critical, so it helps since I worked in an ICU previous that I can help monitor these patients.
Yeah. So it's for some, I guess they'd say it's a real high pressure situation, but it's something that you're well trained for.
Oh, yes, sir. Sometimes it is very critical and very high pressure, but everyone here is very helpful, and then my past background is helped me.
Yeah. So let's talk about your other team members. You know, you have 4, 5, 6 people in here, and when a patient comes in, you have to respond, and everybody knows what to do, I would assume.
Oh, yes. Everybody's here to help. If you need something, there's always somebody here available to help you, answer a question, anything. We have really good teamwork.
What do you think about the atmosphere here at Fairview Park Hospital?
I think it's very positive. I know in the cath lab we're like a family. We get along really well, have fun. I enjoy it.
Yeah. What's the most rewarding part about what you do, Tiffany?
I know like whenever we have a STEMI, which is like an active heart attack, just seeing the patients go from having an 100% occlusion to having reflow in their arteries, you can see a difference pretty much automatically.
Yeah, yeah. Makes you lead a healthier lifestyle too, I'm sure.
Oh, yeah.
Yeah. And so, you know, we always think about Heart Healthy Month and February being Heart Healthy, and that's why we're out here to really recognize what you guys do. What do you tell people when you talk to them, just socially or in the community, or what would you share with our viewers?
Just remember to exercise, like all your doctors always tell you. Eat healthy, and take your medicine like your doctors prescribe.
Yeah, it's real important. And thanks to the team here, and thank you so much, Tiffany. And now we have Anna.
Thank you.
Hey, Anna.
Hey, how are
Hey,
you?
welcome to you. Share everyone your name and what you do here.
My name is Anna Powell. I'm the clinical coordinator of the cath lab.
All right, and so here in the cath lab, you guys have a great team, as we just mentioned a moment ago. Tell me what your experience is like working here.
My experience is we have a very good, like Tiffany said, we are a big family. We take care of each other. We help each other out. We like to take care of our patients. We treat our patients like they are a member of our family, like how we would want our family to be treated.
Yeah, great bedside manner.
Yes.
That's so important, critical time. You don't know what's happening and you come in. But let's share with everyone kind of a typical experience here, a typical day for you, if there is one.
A typical day that we have here. We have outpatients scheduled every day with several of the cardiologists that are here. Sometimes we will have emergency patients come in, so we do take emergency patients. As mentioned before, we have a STEMI program. Our typical day is starts at 7 a.m. Our outpatients get here, we get them ready. We talk to the family members, make sure they know exactly what's going on with the patient and our time frame for that. We bring the patient over, we get the patient ready, the physicians come in, we get the patient taken care of. If they do happen to have a PCI, as Chris had mentioned, which is a stent or balloon, then they get to spend the night at Fairview Park Hospital. And if not, they get to stay with us for a little while and go home with their family.
And what type of training do you have?
Will be here in June, will be 16 years. I was in the emergency department for 11 years, and I've been here in the cath lab for, I guess that would be 5 years almost. Was a flight nurse for 2 years, so I do have emergency room experience. I have trauma experience, critical care experience. So I do have a lot of experience that I can help
teach. And the amount
teach.
of time that you've been here at Fairview Park and you've worked with this type of, what type of advancements have you seen?
Oh, wow. We've started an EP program here, and for what people don't know what that is, that has to deal with your heart rhythm, the electrical system of the heart. We do peripheral work that's dealing with your vascular system, your legs. We put in pacemakers, we put in defibrillators. Our program has grown very big, and we contend with making all the time.
Yeah, that's wonderful. It's such a large area that
Yes.
come to Fairview Park, the 15, 20 counties around us, not just Lawrence, that
Yes.
is affected. So let's talk a little bit about some experience that you may have, a success story, Anna.
I have A success story. Success stories to me mostly mean our STEMI patients when they come in and sometimes they are literally on death's door and the physician gets here in time. We get the balloon in, we get the blocked artery open, and we get the stent in, and that blood is flowing back again. And like Tiffany said, you can tell just about immediately when the patient gets to feeling better. And to me, seeing those patients out in our community after we have seen them and discharged him and they're doing their cardiac rehab, after we've done that, it's really rewarding to see those patients when you're out in the community and they remember who you are and they tell you thank you.
Oh, Anna, thank you for sharing that story. Thank you for joining us, ladies and gentlemen. Anna, thank you. And we have one other lady coming along, Bethany. Bethany, welcome to you.
Thank you.
Let's talk about your experience and what you bring to the cath lab.
Of course. My prior experience is actually cardiovascular ICU and cardiovascular step down. So what I've done in the past was work with patients before they had heart caths and after they had heart caths. So I did the pre-work, I took care of patients after they had caths, and I took care of patients after they went for open heart surgery, which is something that we send a lot of our patients to do. So it's kind of exciting for me to get to do another piece of the puzzle and learn all of the things. So
Bethany, it's an exciting environment, it seems to me, and I almost get the image of a patient coming in and you all as a team doing all your assigned duties and things happening, and then after it's all over, everyone giving each other a high five because you're successful again. It seems that way.
absolutely, we're a really big team and we all come together, and even if there's something going on, we all step in and help each other, and then afterwards it's a relief, and it's great to see even with the patients when they're excited afterwards as well.
Yeah. Then you think about that family element, to be able to give them back to their families, so to speak, to be able to help them and then rehab and grow, as has been expressed. So, all right, so we appreciate what all of the team does here, and we'll take a short break, ladies and gentlemen, and we'll be back with Chris in just a moment. Quality products and installations since 1985. That's 4 Seasons. When you want convenience, you want Neighbors Express, where you'll always find friendly, courteous service every time you visit us. Fill up with pay at the pump. Take advantage of our bigger and better selection of beverages and tobacco products. Enjoy our popular crushed ice with your favorite fountain drink. And you can always enjoy a fresh hot breakfast, lunch, or dinner. So stop by and see us today, where it's always convenient and friendly. Neighbors Express, locations at I-16 at 441 and in Cedar Grove, where we provide farm fuel for all our customers. When you want convenience, you want Neighbors Express. And now back with Chris Kersey. Chris, what a great staff. Thanks for being able to share those young ladies.
Thank you for joining us.
Yeah. And so it's great to see what all, in a way, goes on here and the people that you help. What do you tell people, though, when they think they may be having chest pains? What's a rule to go by?
Yeah, definite rule to go by is if you are having chest pain, a lot of times that pain will rate in. When I say a chest pain, I mean it's onset, it's immediate onset, is what we call here at the hospital acute pain. If it radiates, especially on one side or the other, any type of suspicion that you have that you may be having a myocardial infarction, heart attack, aka heart attack, it's definitely best to call 911. What you don't want is to let it sit, let it wait, and have family members drive you and whatnot. Our EMS, we work very closely with them when it comes to our cardiology program as a whole here at Fairview Park. And they are trained for in the field to be able to provide care even on the ambulance before you got here. And so it's best to call 911 and let us come and take care of you there.
Yeah. You know, you think of the heart being a muscle. And so that time is really important, isn't it?
It's very important. You know, the process of opening a blood vessel in the heart or anywhere has only been around since the early 70s. The process of angioplasty, the procedure itself, has only been around since the early 70s. To see the advancement that we've made in healthcare, the technology of healthcare, in the last 40 to 50 years is just amazing. It excites me for the future, even that I hope to see in my own lifetime, of where this, between technology, between advancements, between how physicians are trained and how team members are trained to provide, immediate care in a potential life-threatening situation. It excites me to see that, having known that it's only been around for 40 to 50 years, and to see how far we've come.
Yes.
So time is muscle, as we say. What's most important is to get that vessel open as quick as possible, which is why we work to improve what we do daily. Above all else, we are committed to the care and improvement of human life. That's our mission here at Fairview Park, and we truly live by that mission.
Chris Kersey, everyone, thank you for what
My
you
pleasure.
do. Thank you for what Fairview Park Hospital means to our community and to all those communities all around us. Thank you for joining us right here on TV 35.